This is an update on the surgery's plans and procedures at this point of the coronavirus pandemic. In this bulletin, we're going to discuss the services that we're prioritising and the services that we are unfortunately postponing in line with national guidance, our approach to suspected COVID-19 cases, including where people should seek help if they think that they have coronavirus, a discussion of social distancing, isolation, and shielding and who these apply to. A reminder that not all coughs are coronavirus, and especially in children, if you're concerned, we'd like you to discuss this with the surgery. A reminder about research studies which are looking to recruit volunteers, both healthy and suffering from coronavirus, to improve our understanding of this disease, and a reminder about where to seek help with related issues during the lockdown period, either with obtaining essential supplies, with obtaining financial support, or with mental health difficulties.
But firstly, we would just like to start with a heartfelt thank you to everyone who is joining together to fight coronavirus. We're particularly grateful to all our staff in our local hospitals, coping with the steadily increasing number of very unwell people needing treatment. We would also like to recognise the work of the Ambulance Trust, the staff in primary and community care, in community hospitals and clinics, community pharmacies, and in social care. Everyone is pulling out the stops and showing great courage in continuing to perform their essential roles despite the growing unease as cases multiply. We're grateful for all of the administrative and managerial staff supporting this effort by redesigning systems in ways that we wouldn't have even considered possible a few weeks ago. And we're grateful to the public in our area for coming together to support the vulnerable in so many different ways and for taking the threat of coronavirus seriously. Your efforts to limit the spread of this virus are absolutely essential. Please do continue to carefully follow the government's instructions.
During the COVID-19 lockdown, we are following national guidance on prioritising certain types of care. We have put a detailed list on the practice website. Please see the Coronavirus Service Update page. Our key priorities are patients who believe themselves to be unwell, continuation of supply of medication to those requiring regular repeat prescriptions, investigations for any conditions suspected to be cancer, immunisations for children, monitoring tests for high-risk medications like warfarin or methotrexate, and the provision of palliative care support. Activities that are paused during the pandemic are provision of assessments for mild self-limiting illnesses. These patients are advised to use NHS Choices or the upcoming Dr. Link app to check their symptoms initially. Minor surgery, routine monitoring tests such as spirometry or NHS health checks, and medical or insurance reports.
The approach to the suspected COVID-19 infection. If you think you may have coronavirus symptoms, the first port of call remains the NHS 111 webpage. This takes you through screening questions and may instruct you to ring 111 for further discussion. This is a route to be assessed by a coronavirus clinical assessment service. These are being set up in many areas to bring together expertise and adequate infection control measures for safe assessment of suspected infectious patients. You may be advised to travel to a centre away from our normal practice premises. If you are identified as having severe symptoms at any stage during the assessment process, you may be advised to call the emergency number 999 and an appropriate emergency response will be sent to you. In some cases, after triage, your inquiries may still be put back through to the practice for more borderline cases or where symptoms are thought to be associated with a problem other than coronavirus. We may need to perform a face-to-face assessment. If we do need to see you in person under these circumstances, we will instruct you carefully on how and when to attend the surgery, keeping you separate from other patients. You should expect that we will be wearing gloves, masks, aprons and goggles for these face-to-face assessments in line with national guidance.
Social distancing, isolation and shielding. We have included the definition of these terms from the British Lung Foundation on our website's coronavirus page. In a nutshell, we should be practising social distancing, staying at home, minimising essential journeys, careful hand hygiene and keeping a safe distance from others. People with suspected coronavirus or their household members should be practising self-isolation for between 7 and 14 days, which means not going out at all during that time. People at higher risk of complications of coronavirus but without symptoms will be advised to shield themselves. This means not leaving the house at all and being very careful to reduce routes for the virus to get into your house. The government has written to most people in the shielding categories, although there are still people to be identified who will be receiving letters in the next stage. Further details about all measures involved and levels of risk is published on the NHS website. You can Google NHS COVID-19 and it pops up.
Not all coughs are coronavirus. Please bear in mind that even with the world's attention focused on COVID-19, there are still lots of other illnesses in our communities requiring different management. In particular, a message is coming out from our hospital colleagues in pediatrics that children are currently presenting later than usual at the hospital, particularly with the breathing and cough problems, and are consequently sicker than usual intake. It is worth noting that children are largely less affected by coronavirus than adults, and we should therefore carefully evaluate any child presenting with breathing difficulty or persistent cough for alternative diagnosis. This is especially so when symptoms are worsening or going beyond few days that might be expected of the average cough in children. Parents can Google Mid-Essex Child Health app for more detailed information presented for smartphone users.
Coronavirus is clearly a new disease, and the pandemic that we're experiencing represents an opportunity to find out more about how this disease behaves. There are many research studies trying to recruit both healthy and ill volunteers to collate information about the factors that make this illness worse and the factors which reduce its transmission. So if you feel you would like to get involved, there are a number of links on our website. And finally, where to seek help during this pandemic? Well, the Gov and NHS websites are trying to act as central points for information related to all the various difficulties indirectly and directly caused by the COVID-19 virus, including financial strain, difficulty getting essential supplies, and also anxiety that this situation is causing to people. For our area, there's also the Essex Welfare Service, which is specifically aimed at those struggling to cope during self-isolation or shielding due to perhaps a lack of support from friends, family or neighbours. And this is linked to the Essex Coronavirus Action Facebook group. We've published links to these pages on our website. For those suffering understandable distress and anxiety due to the COVID-19 pandemic, there are also links on our website, the coronavirus page, for various organisations offering support specific to this situation.